Thank you, Mr. Chair. Today's hearing comes at a critical moment for public health and safety. All Americans should be able to trust that our government is working to ensure their food and medicine will be safe and affordable. But over the past 2 months, the Trump administration has purged thousands of FDA workers, putting this essential mission and American lives at risk. Last week, the administration purged 10,000 people at HHS, including 3,500 FDA employees. This was on top of a purge of approximately 1,000 FDA workers in February. And Secretary Kennedy subsequently admitted that 20% of last week's purges should not have happened. Tried to brush it off, saying, quote, "We'll make mistakes, but how long will it take them to realize the full extent of the mistakes that they've made? How long will it take for them to try and very possibly fail to undo them? And how many Americans will get sick or die in that time?" The FDA is supposed to make sure that our children have the vaccines they need to survive outbreaks of preventable diseases like measles, which has killed at least 2 children in the U.S. since February and sickened more Americans in 2 months than the entirety of 2024. The FDA is supposed to protect us from counterfeit drugs and contaminated infant formula, which are serious bipartisan concerns. But how is the agency supposed to stop dangerous illicit products from entering American homes and threatening American lives when underfunded food and drug inspection teams are being cut even more? 170 employees from the FDA's Office of Inspections and Investigations were reportedly let go last week. And let me tell you some of the expertise we're losing because of the administration's actions besides that. They fired people responsible for regulating e-cigarettes and ensuring that predatory companies cannot market vapes to children. They fired people responsible for monitoring drugs for side effects and updating warning labels. They have fired the scientists monitoring bird flu and taking steps to prevent it from killing people. They fired the scientists with expertise in fighting heavy metals, toxins, and additives in our food supply. And they fired the people who monitor prescription drug shortages and ensure that Americans have access to affordable prescription medications. How is this making Americans healthier? We all know the answer to that question. It's not. People are going to die. And as a dad, I'm especially concerned by the administration undoing the progress we've made to protect babies from contaminated infant formula and formula shortages. And we should all be concerned by the risk posed by contaminated meat and produce. This chaos will keep us in the dark about looming shortages for essential drugs like antibiotics and chemotherapy drugs, and it will leave people no choice but to pay for pricey brand name drugs because there are no FDA employees to prove generic versions. In the name of efficiency, this administration even fired employees who were critical in approving new medications, meaning Americans will have to wait longer for new treatments, if they get them at all. And on top of that, we just heard last night from the president that pharmaceutical tariffs will be next, making the drugs we all rely on even more expensive. One of the Americans impacted by these cuts is one of my constituents, a former teacher who spent 35 years working at the Department of Education. She has idiopathic pulmonary fibrosis, a terminal lung condition that took her aunt's life and is slowly taking hers. It's a rare disease that doesn't get much funding, but she had hope. A drug to slow down the disease received the FDA's breakthrough therapy designation in 2022, and the trials show that it might actually stop the progression of her disease. Her doctor anticipated FDA approval this year, but the FDA's funding cuts and the firing of researchers and staff who sit on the approval committees have made this impossible. This administration is stripping both hope and life-saving medications out of the hands of Americans who need it most. The FDA can and must do more for Americans, addressing our country's chronic disease epidemic, ensuring our children are set up to live long and healthy lives, getting more life-saving medications to those who need them, and ensuring that food on our shelves is safe and wholesome should be at the top of that list of things to do. But rather than making it better, more efficient, this FDA is left ransacked and reeling from the chaos and destruction of the Trump administration. It's unclear whether the agency can even perform some of its most basic functions anymore. I don't know how much clearer I can be. These health cuts will kill people. They will make us less safe and less healthy. I was not elected to watch people suffer from diseases awaiting new treatments while this administration dismantles the offices that offer that hope. It's the responsibility of this committee to conduct meaningful oversight. If we are not talking about this and doing something about these cuts, we're not doing our jobs. I yield back.